Migraines are more than just headaches. They are complex neurological conditions that can significantly impact daily life. Understanding how doctors diagnose migraines is crucial for anyone experiencing frequent or severe headaches. In this video, we'll walk through the step-by-step process that healthcare professionals use to identify migraines, from the initial consultation to the final diagnosis. By the end, you'll have a clear picture of what to expect during a migraine evaluation and why each step matters. The diagnostic journey begins with a detailed medical history. Doctors ask about the frequency, duration, and intensity of your headaches. They'll want to know when the headaches started, how often they occur, and if there are any patterns or triggers. This information helps distinguish migraines from other types of headaches. Family history is also important, as migraines can run in families. Providing accurate and thorough answers at this stage sets the foundation for an accurate diagnosis. Next, doctors focus on the specific symptoms you experience. Migraines often come with unique features such as throbbing pain, sensitivity to light or sound, nausea, and sometimes visual disturbances called aura. Your doctor will ask you to describe your symptoms in detail, including where the pain is located, how it feels, and what makes it better or worse. This helps differentiate migraines from other headache disorders and guides the next steps in diagnosis. Doctors will also ask about potential migraine triggers. These can include certain foods, stress, hormonal changes, sleep patterns, or environmental factors. Understanding what might be triggering your migraines is essential for both diagnosis and future management. Keeping a headache diary before your appointment can be very helpful, as it allows you to track patterns and share detailed information with your healthcare provider. After gathering your history and symptoms, the doctor will perform a physical and neurological examination. This step checks for any signs that might point to other causes of headaches, such as tension headaches or more serious conditions. The doctor may assess your reflexes, muscle strength, coordination, and sensory responses. Most migraine diagnoses are based on history and symptoms, but the physical exam helps rule out other possibilities. A focused neurological assessment is a key part of the diagnostic process. The doctor will check your vision, eye movements, balance, coordination, and reflexes. This helps ensure there are no neurological deficits that could indicate a more serious issue, such as a brain tumor or stroke. If the neurological exam is normal and your symptoms fit the migraine profile, a diagnosis of migraine becomes more likely. Doctors use established criteria to diagnose migraines, most commonly the International Classification of Headache Disorders, ICHD. According to these guidelines, migraines are characterized by recurrent headaches lasting for 72 hours, with at least two of the following: unilateral location, pulsating quality, moderate or severe pain, and aggravation by routine activity. Additionally, at least one symptom, such as nausea, vomiting, or sensitivity to light and sound, must be present. Some migraines are accompanied by aura neurological symptoms that usually precede the headache. These can include visual disturbances like flashing lights, zigzag lines, or temporary vision loss, as well as sensory changes or speech difficulties. Your doctor will ask if you experience any of these symptoms, as the presence or absence of aura helps classify the type of migraine and guides treatment decisions. A critical part of diagnosing migraine is ruling out secondary causes of headaches, such as infections, tumors, or vascular disorders. Doctors look for warning signs like sudden onset, severe intensity, or neurological deficits. If any red flags are present, further testing is needed. This step ensures that the headache is not a symptom of a more serious underlying condition. Imaging tests like MRI or CT scans are not routinely required for migraine diagnosis. However, if your symptoms are atypical or if there are warning signs, your doctor may order these tests to rule out other conditions. Imaging helps detect structural abnormalities, tumors, or bleeding in the brain. Most people with classic migraine symptoms and a normal neurological exam do not need imaging. Blood tests are rarely needed for diagnosing migraines, but they may be ordered if your doctor suspects another cause for your headaches, such as infection or metabolic disorder. These tests can help rule out anemia, thyroid problems, or other systemic illnesses that might contribute to headache symptoms. For most migraine patients, lab tests are not a routine part of the diagnostic process. One of the most important steps is distinguishing migraines from other types of headaches, such as tension type or cluster headaches. Doctors use your history, symptoms, and exam findings to make this distinction. Migraines typically have unique features, like throbbing pain, nausea, and sensitivity to light, which helps set them apart from other headache disorders. Doctors often recommend keeping a headache diary to track the frequency, duration, and triggers of your headaches. This tool helps both you and your doctor identify patterns and assess the effectiveness of treatments. Recording details about each headache episode provides valuable information for diagnosis and ongoing management. Doctors will ask how migraines affect your daily activities, work, and social life. Understanding the impact helps guide treatment decisions and may influence the urgency of intervention. Migraines can be disabling, so assessing their effect on your quality of life is an important part of the diagnostic process. The frequency and severity of your migraines are key factors in diagnosis and management. Doctors will ask how often you experience headaches and how intense they are. This information helps determine whether you have episodic or chronic migraine and influences treatment planning. Migraines often come with symptoms beyond headache, such as nausea, vomiting, dizziness, or sensitivity to light and sound. Your doctor will ask about these associated symptoms as they help confirm the diagnosis and may influence treatment options. The presence of these features is a hallmark of migraine. Doctors may ask how your headaches respond to over-the-counter or prescription medications. A good response to migraine-specific treatments, such as triptans, can support the diagnosis. This information also helps guide future treatment strategies and may indicate whether preventive therapy is needed. Frequent use of pain medications can lead to medication overuse, headache, which can complicate migraine, diagnosis, and management. Doctors will ask about your use of painkillers and other headache remedies. If medication overuse is suspected, your doctor may recommend changes to your treatment plan to break the cycle of rebound headaches. Migraines are often associated with other health conditions, such as anxiety, depression, or sleep disorders. Your doctor may ask about your mental health and sleep patterns, as these factors can influence both diagnosis and treatment. Addressing comorbidities is important for comprehensive migraine care. A family history of migraines increases your risk of developing the condition. Doctors will ask if close relatives have similar headache patterns. This information supports the diagnosis and may help predict your response to certain treatments. Genetics play a significant role in migraine susceptibility. Hormonal changes, such as those related to menstruation, pregnancy, or menopause, can influence migraine patterns. Doctors will ask female patients about their menstrual cycles and any relationship to headache onset. Understanding hormonal influences helps tailor treatment and may explain changes in migraine frequency. Sleep disturbances are common in people with migraines. Doctors will ask about your sleep habits, including how much rest you get, sleep quality, and any issues like insomnia or sleep apnea. Poor sleep can trigger migraines or make them worse, so addressing sleep issues is an important part of diagnosis and management. Certain foods and lifestyle habits can trigger migraines. Doctors may ask about your diet, caffeine intake, alcohol use, and exercise habits. Identifying and modifying these factors can help reduce migraine frequency and improve overall health. Lifestyle changes are often recommended alongside medical treatments. Environmental factors such as bright lights, loud noises, strong smells, or changes in weather can trigger migraines for some people. Your doctor will ask if you notice any connection between your headaches and your surroundings. Recognizing these triggers can help you avoid them and reduce migraine attacks. Stress is a well-known migraine trigger. Doctors will ask about your stress levels, coping mechanisms, and any recent emotional events. Managing stress through relaxation techniques, counseling, or lifestyle changes can be an important part of migraine care. Emotional well-being is closely linked to headache, frequency, and severity. Doctors may ask about your level of physical activity, as both too much and too little exercise can influence migraine patterns. Regular, moderate exercise is often recommended, but intense activity can sometimes trigger headaches. Understanding your exercise habits helps tailor advice and treatment. If you've tried treatments for headaches in the past, your doctor will review what you've used and how effective it was. This includes medications, lifestyle changes, and alternative therapies. Understanding your treatment history helps avoid repeating ineffective strategies and guides future care. Chronic migraine is defined as having headaches on 15 or more days per month, with at least 8 days featuring migraine symptoms. Doctors will ask about the number of headache days you experience to determine if you meet criteria for chronic migraine. This distinction is important for treatment planning and insurance coverage. Some people experience rare forms of migraine, such as hemiplegic migraine or vestibular migraine. Doctors will ask about unusual symptoms like temporary weakness, loss of coordination, or vertigo. Identifying these rare types is important for proper diagnosis and management, as they may require specialized treatment. Migraines can sometimes lead to complications, such as status migrainosus, a migraine lasting more than 72 hours, or migrainous infarction stroke associated with migraine. Doctors will ask about prolonged or severe attacks and any neurological symptoms that persist after the headache resolves. Early recognition of complications is vital for prompt treatment. An important part of the diagnostic process is educating patients about migraines, their triggers, and management strategies. Doctors will explain the nature of migraines, how to recognize warning signs, and what steps to take during an attack. Empowering patients with knowledge helps improve outcomes and encourages active participation in care. Doctors and patients work together to make decisions about diagnosis and treatment. Shared decision-making involves discussing options, preferences, and concerns. This collaborative approach ensures that care is tailored to your needs and increases satisfaction with the diagnostic process. Migraine diagnosis is often an ongoing process. Doctors may schedule follow-up appointments to monitor your symptoms, review your headache diary, and adjust your treatment plan as needed. Regular follow-up helps ensure that your diagnosis remains accurate and that your care evolves with your needs. In some cases, your primary care doctor may refer you to a neurologist or headache specialist for further evaluation. This is especially true if your diagnosis is unclear, your migraines are difficult to control, or you have unusual symptoms. Specialists have advanced training in headache disorders and can offer additional diagnostic and treatment options. Specialists may use additional diagnostic tools, such as electronic headache diaries, questionnaires, or specialized imaging to further clarify your diagnosis. These tools provide more detailed information about your headache patterns and help confirm the diagnosis of migraine. Genetic testing is rarely needed for migraine diagnosis, but may be considered in cases of rare hereditary migraine syndromes, such as familial hemiplegic migraine. If your doctor suspects a genetic cause, they may refer you for specialized testing. This step is only necessary for a small subset of patients. Accurate documentation of your symptoms, diagnosis, and treatment plan is essential for quality care and insurance purposes. Doctors use specific codes to record your diagnosis in your medical record. This ensures continuity of care and helps with insurance claims and referrals. Doctors may provide information about support groups, educational materials, and online resources for people with migraines. Connecting with others who have similar experiences can be helpful for coping and learning new management strategies. Support resources are an important part of comprehensive migraine care. Throughout the diagnostic process, doctors remain vigilant for red flag symptoms that may indicate a more serious condition. These include sudden, severe headaches, headaches with fever or neck stiffness, or headaches with neurological symptoms. Prompt recognition and response to red flags are critical for patient safety. To summarize, diagnosing migraine involves a thorough medical history, symptom assessment, physical and neurological exams, and careful exclusion of other causes. Additional tests are only used when necessary. This step-by-step approach ensures that the diagnosis is accurate and that you receive the most appropriate care for your condition. An accurate diagnosis is the foundation for effective migraine management. It ensures that you receive the right treatments and avoid unnecessary tests or medications. If you suspect you have migraines, seeking medical evaluation is the first step toward relief and improved quality of life. Patients play an active role in the diagnostic process by providing detailed information, keeping headache diaries, and following up with their healthcare providers. Open communication and accurate reporting help doctors make the best possible diagnosis and tailor treatment to your needs. Migraine is a chronic condition that often requires ongoing monitoring and adjustment of treatment. Regular check-ins with your doctor help track progress, address new symptoms, and ensure that your care remains effective over time. Staying engaged in your care leads to better outcomes. If you experience sudden, severe headaches, headaches with fever, confusion, weakness, or vision changes, seek immediate medical attention. These symptoms may indicate a serious condition that requires urgent evaluation. Knowing when to seek help is an important part of migraine management. Diagnosing migraine is a careful, step-by-step process that involves collaboration between you and your healthcare provider. By understanding the process, you can be better prepared for your appointments and play an active role in your care. If you suspect you have migraines, don't hesitate to reach out to a healthcare professional for evaluation and support. With the right diagnosis, effective management is within reach.